Good evening. I'd like to welcome everyone to the monthly meeting of the Pitt County Board of Health. At this time, I'd like to see, first of all, call the meeting to order. Are there any public comments tonight? We'd like to welcome the East Carolina University nursing students as visitors tonight, and hope you all learn some things and maybe look forward to a career in public health down the road. So thank you all for being here. We have the minutes of the previous meeting that have been circulated. Are there any corrections or additions to those minutes? Okay, hearing none, is there a motion for approval?
So moved.
Second. Any further discussion? All in favor say aye.
Aye.
All right, the minutes are approved. We'll move on to fiscal report. Marcia Hall.
New year so far. In front of you, you have period 7, ending the month of January 2019. We did have a few budget amendments the month of December. We did not have any in January. You'll see that we did receive some money from the Women's Health Branch, the Healthy Children, North Carolina Baby Love. I mentioned that in the November meeting. That was what was added. We've had a budget amendments of $297,000, bringing our overall budget to 11.7. We do have, as usual, our timing items with county funding, our Medicaid cost study that we're still working on, and our state funding. It's averaging around $300,000 a month. So if you take into account the timing items, we have a surplus of around $363,000. Just want to mention that in December, longevity was paid out, and then upcoming in March, we'll have a 3 payroll month.
All right, any questions for Marcia tonight?
So moved.
Motion approved. Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right. Thank you very much.
You're welcome.
This report's approved. Do you have any other information for us? Or?
I just wanted to mention one big thing. Thursday afternoon, we received our prepaid health plans for the community care Medicaid transformation. We are starting to look through these, and glad we were in the last region to go live so we can figure out what's working and what's not working. Also, we are working hard for the budget for fiscal year 1920, so I get to share that with you next month. I know you're excited. And other than that, we're just getting ready for accreditation and working on the Medicaid cost study.
Very good. Well, thank you very much. We'll look forward to that next month.
Yes. Oh, one more thing. I forgot to report on this in November. Currently, we have 13 vacant positions in various stages of the application process. Just wanted to let you know.
Okay. How many of those are in sort of primary care type positions?
We have 3 nurses, actually 3, 4, 5, 6 nurses that are vacant or in various stages.
Well, I think we, at one of the county commissioner meetings, Dr. Morrow had spoken and asked about along with Commissioner Colson, talked to the commissioners about the challenges of filling these clinical positions with a long waiting period and all. And so I think Scott Mitchell indicated that they can list those a little bit earlier as long as we make a request. So Amy, if we haven't done that, let's maybe talk in the background about how to do that. And
they have been doing that for the nursing positions.
Okay, very good.
And I've been trying to recruit the ones here as I was riding the elevator.
Very good. Thank you, Marcia.
You're welcome.
Okay, other items, reaccreditation update. Amy Haddam.
Alrighty. Well, staff have been working extremely hard for the past several months preparing evidence that is now being reviewed by the local health department accreditation site visit team. And this evidence that has been collected and is in review is evidence of our team performing great work and providing great quality services. So we're going to have a site visit by this team March 7th and 8th. In the site visit, the team will continue to review evidence at the health department. One of the things, or several of the things they'll be looking for, the cleanliness of the building, Signage, we also need to make sure that our signage, all of it, is in Spanish as well as Braille. And it has been, we've just had some updated signage recently. We also have some new TV monitors that's going to help us display timely messages to our patients while they're in the waiting room. Making sure that our building is accessible according to the American Disabilities Act. They're also going to be looking at our policies and procedures and making sure that those are up to date. So I want to commend all the staff from the health department for the hard work that they've been doing to get us ready for accreditation and to show that we really are a quality agency. But I also want to make sure that, thank Marcia Hall. Marcia has been coordinating many efforts to get our building updated, many repairs that have been needed, and she's been working on that for the past year. So many thanks to you, Marcia, for doing that, and for also finding the money to make it happen on a shoestring budget. Want to also thank Carla Hansen, Mike Emery, and Kyle Kettler with the County Office of Public Information for the design of the new signage and for helping us to select the TV monitors. And thanks to Betsy Wallace for helping to make sure that those TV monitors were as inexpensive as possible by Black Friday shopping. So it's been a team effort to make all that happen. And also we can't forget Buildings and Grounds and Mike Rogers, who leads that team. That they've been working really hard with taking down wallpaper, painting the building, any repairs that have been needed. So we're very thankful for all of that. It's only been a team effort. So March 7th and 8th, we hopefully by the 8th we'll know that we are a re-accredited agency.
Very good. Does anybody have any questions for Amy? Very good. All right, well, let's move on to strategic planning session update.
Okay. The Board of Health, this board as well as the management team will be meeting this Saturday, February 16th from 9 to 1, and we'll be working on a new strategic plan for the health department. An outside training and development coordinator, Kendra Harris, will lead this session, and this plan will be a long-range plan for goals over the next 4 years. And not only is this a good practice for the health department to assess the needs of the community, but it's also a requirement of reaccreditation.
All right, does anybody have any questions? This is certainly an important event. I think I was on the board when we had the last one, so we'll look forward to, and this is where we actually take data and sit down and grind out what we feel like the priorities should be for the long term, so very good. Okay, let's go on to, for new business, we have the Child Fatality Prevention Team Report, and Jennifer Hardy going to present that.
Good evening. I feel like every time I come, I'm talking about death. So at some point in time, I hope to present on a happier topic, but that is not the case for tonight. I'm going to give you the annual report for the Child Fatality Prevention Team. So just for a quick introduction, the North Carolina Child Fatality System was established by legislative decree in 1991, and then the state statute is listed. The North Carolina Child Fatality Task Force was also established in 1991, and then the state team was established in 1992, and then local teams were established a year later in 1993, and there's one in every county. The purpose of the North Carolina Child Fatality Prevention System is to promote understanding of the causes of child deaths, identify deficiencies in the service delivery to children and families by public agencies, to assess, recommend, and implement systems for change that will prevent future child deaths and support safe and healthy development for our children. The CFPT includes appointed representatives of public agencies, non-public agencies, and the community. So how it is set up, we do have a chair, and it is the health director, and I come in and co-chair the local team. We have a review coordinator, and she's absolutely fabulous, Portia Mizell. Team members include DSS director or the representative, DSS staff member, DSS board meeting member, law enforcement office, district attorney's office, the community action agency, Pitt County Schools, mental health, guardian ad litem, healthcare provider, health director or representative, EMS firefighter, district court judge, medical examiner, child care Head Start representative, parent, and other members appointed by the county commissioners. The full child fatality prevention team meets quarterly, and the subcommittee meets quarterly, but they meet the month prior to the full meeting. And during that meeting, we actually decide which cases will be reviewed. And then CFPT has statutory access to records of birth and death certificates, medical facilities, the Department of Social Services, courts, law enforcement agencies, the school system, and any outcomes of services and circumstances surrounding the child's death. The main goal of the Child Fatality Prevention Team is to review child deaths and study ways to prevent child fatalities. Other purposes are to identify deficiencies in the delivery of services to children and families by public agencies, make and carry out recommendations for changes that may prevent future child deaths, promote the understanding of the causes of child deaths, and then also advocate for children. So in Pitt County, our team, we did review some of the deaths that were presented to us. And the actual, even though it was a 2018 meeting, the deaths were from 2017. We just reviewed them 1 year later. So in 2017, there were 34 child deaths, and the Child Fatality Prevention Team chose to review 6 of those. Many of the deaths that we did not review were related to prematurity or birth defects or both. Some of the system problems that we found during the review: of course, unsafe sleep practices continues to be identified as a problem in several of the cases. Also, a lack of communication between medical providers, home health, and social services. We also identified that there was issues with waiting on medical records for medically fragile patients with lengthy stays and the inability to identify the child's medical home. So actions to be taken based on that is to continue to promote the Cribs for Kids program in the community and offer regular classes for access to pack and plays and safe sleep education. We also have paid television commercials that are airing right now through June, and they do work. I get a lot of phone calls based off of those saying that they've seen the commercial from television. Also, DSS is considering a multidisciplinary team to assist with children with complex medical conditions. And DSS is also exploring the benefit of having access to a medical consultant so that they have timely answers to medical questions that they might have. So a little more about Cribs for Kids. We do have a few criteria that participants have to meet. They have to be a Pitt County resident. They have to be pregnant or have a child that is under 12 months of age. And also, they need to be receiving public assistance, so WIC, food stamps, Medicaid. In 2018, we had 41 classes with 336 participants. And then also we have 3 health educators who are trained to provide the classes that we offer. Do you have any questions for me?
Questions for Jennifer?
How have you seen the, of the cases that you look at, how have you seen that change over the years that you've been doing this? Have you seen a change, or are you seeing the same problems, or have you made progress identifying and correcting problems?
I think we've been seeing some of the same problems. I've been with child fatality for about 5 years, and since I started, I've seen a lot of safe sleep issues, not just not putting children on their backs to sleep, but other, unsafe sleep situations. And then also prematurity and birth defects continues to be a huge issue, which, I talk about that regularly in my infant mortality review as well.
I was curious about the medical record challenge you brought up. The Affordable Care Act several years ago required that each physician's office or group practice would have an electronic health record, and so I know of at least 3 different electronic health record brands are in Pitt County. There may be more, but I know of 3, and they don't talk to each other very well. Certainly with the addition of Epic to the health department will be a help, but I don't know that any of these children may have even been cared for by the health department itself. Was that one of the issues that came up underneath, let's say, a subheading underneath your medical record?
Yes, sir. They identify that the medical records did not talk to one another.
Yeah. I understood that Congress was going to look at that, but you never know what they're actually going to pass. So, very good. Does anybody have any other questions for Jennifer?
Thank you.
Thank you very much.
Thank you.
And let's see, the next one, 2019 Community Health Needs Assessment, Amy Haddam, the Interim Health Director, and Stephanie Cabanis.
Good evening.
Good
I'm
evening.
Stephanie Cabanis, and I'm the coordinator for Pitt Partners for Health, and we're going to tag team this presentation, and there's a lot of data, so bear with us.
Okay, well, first we'll start off with what is the CHNA, or the Community Health Needs Assessment? Simply, it's an assessment of the health needs of our community, and then where we plan strategies to improve the health of our community. Lots of action plans that are put into place to address the needs that are found within the plan, or within the assessment, rather. Local health departments have been conducting community health needs assessments for over 30 years and then putting plans in place to address those needs. It's been a requirement of the North Carolina Department of Health and Human Services, as well as our accreditation process. And probably back in 2006, I believe it was, is when local hospitals, not-for-profit hospitals, were required to also produce a community health needs assessment. It's a requirement of the Affordable Care Act as well as the IRS. It's been a team effort since then between the hospital and the health department to produce one joint assessment. So how we got here, the data that we're going to present to you tonight, the majority of that does come from findings from Health ENC, which is a paid vendor named Conduent. What has happened with this process, there's a outside vendor that was hired on behalf of 33 counties to do a regional assessment so that we can compare data from county to county within eastern North Carolina, and then hopefully plan strategies to address health needs within each county, and then each county working together. We also have based the data that's been gathered, because we have produced some additional data, on the Healthy North Carolina 2020, A Better State of Health Objectives. And in addition to that, we've collected primary data, which Stephanie's going to talk with you about in just a little bit. But we did this past summer a community opinion survey that was collected, where surveys were collected online from our community members, as well as focus groups, which Stephanie will also talk to you about. And that's where we got the majority of the data for this assessment. So after hearing tonight's presentation, you as a board will be asked to think about health priority setting for the next 3 years. We're not asking you to choose tonight, but since we're having that strategic planning session this coming Saturday, at that point in time we'll ask you to look at what we have done over the past 3 years with the health priorities that were chosen then, and think about whether or not we want to choose new ones or continue to focus on the ones we already have. We do have a disclaimer. Since the majority of this data was provided by Health NC, and normally we are collecting our own data, we do need for you to know that the data we're presenting, majority of it is representing Health NC. We have found a few errors in some of that data, and we've sent back to them for some corrections. And we have to remember, though, this was a big project for them to take on to collect data for 33 counties. So we're working through that process now. And as I mentioned before, we also supplied data, additional data, to the draft report. Selected health priorities will be added to the report, and then a draft report will be due to the state in March. The final report will not be available to the public until sometime this summer, because once you select health priority areas, we put those in the report, then we will send it to the state for approval. Once we receive state approval, then we'll make it known to the community. So we'll start out with some of the secondary data. Looking at population, people 65 years and older comprise 11.9% of Pitt County's population, compared to 15.5% in North Carolina and 15.2% in the Health Eastern North Carolina counties, those 33 counties. Whenever we say Healthy NC, that's what that means. So looking at this, we found out that we have a much younger community than we really originally thought. That will help us in planning some of our strategies. And then breaking this down, population by race and ethnicity. So the race and ethnicity composition of a population is important with planning for future community needs, particularly for schools, businesses, community centers, healthcare, child care. It's also, the data is useful for identifying and understanding disparities in housing, employment, income, and poverty. So that's why we look at this as part of the assessment. So this graph shows the racial and ethnic distribution of Pitt County compared to North Carolina and the Healthy NC counties. The first 6 categories of white, black or African American, American Indian or Alaska Native, Asian, Native Hawaiian, and other Pacific Islander and multiracial are racial groups and may include persons that identify as Hispanic or Latino. The 7th category, Hispanic or Latino, is an ethnic group and may include individuals that identify as any race. So the portion of residents that identify as white is smaller in Pitt County at 59.8% as compared to North Carolina at 71%, and compared to Eastern North Carolina counties at 63.8%. Pitt County has a large share of residents that identify as black or African American at 35.3% when compared to North Carolina, which is 22.2%, and compared to Eastern North Carolina counties at 30.7%. The Hispanic or Latino population comprises 6.2% of Pitt County, which is smaller than the proportion of that population in North Carolina at 9.2%, and compared to Eastern North Carolina counties at 9.6%.
All right, so I'll talk about some primary data now. The primary data that was collected or that were collected consists of 2 things, the community surveys and the focus groups. For the surveys, there were 57 questions, and it was online, and also there were paper submissions. For the focus groups, there were 9 total questions that were asked of the people. We're going to start with the community survey first. Now, the next slide. Thank you. These are the characteristics of the 872 people who responded to the survey, including education level, employment status, and healthcare coverage. Over 75% of those who completed the survey have a bachelor's degree or higher. Over 76% were employed full-time, and over 74% had healthcare coverage of some kind, such as through an employer. However, the focus group's responses balanced this feedback as they were comprised of individuals who worked directly with all aspects of the overall Pitt County population. Those were data about the survey respondents, including you if you took the survey. And now we'll cover how the people responded to questions around quality of life issues, services needing improvement, and health behaviors that residents needed more information on. All right, so this figure shows the list of community issues that were ranked by residents as most affecting the quality of life in Pitt County. Low income and poverty was the most frequently selected issue and was followed by drugs and substance abuse. Less than 2% of survey respondents selected homelessness, pollution, domestic violence, child abuse, neglect and abuse, rape, sexual assault, or elder abuse as issues that were affecting the quality of life in Pitt County. And the graphs are a little bit difficult sometimes to see all that, so the highlighted portion of there are kind of highlighting the top 3 as we go along. All right, this chart displays the level of agreement among Pitt County residents in response to these 9 statements about their community, and I don't know if you can see those, so I'm actually going to read those to you. For these questions, more than half of the survey respondents agreed or strongly agreed that the county is these things: an easy place to buy healthy foods, has good parks and rec facilities, has affordable housing, offers plenty of help for people during times of need, is a safe place to live, has plenty of economic opportunity, a good place to grow old, a good place to raise children, and has good health care. The next graph shows the list of services that were ranked by residents as needing the most improvement. Road maintenance was the most frequently selected issue, followed by higher paying employment, counseling, mental health, support groups, and positive teen activities. Next graph is a list of health behaviors that were ranked by residents as topics that Pitt County residents need more information about. And that's how the question was worded. The top 3 behaviors that residents need more information about were substance abuse prevention, eating well or nutrition, and managing weight. All right, so another form of community input was collected through the focus groups. We've talked about the community surveys. Now we're going to go into the focus groups. The focus groups are carefully constructed dialogues that invite diverse groups of people to discuss important and pressing issues. They provide community members an opportunity to engage in productive learning and sharing sessions. Group discussions focused on community strengths, opportunities for improvement, existing resources, health needs, and possible solutions for improving the health of Pitt County. The purpose of the focus groups for Health ENC's 2019 CHNA or CHA was to engage with a broad cross-section of individuals from each county, such as migrant worker groups, healthcare workers, or county employees, just to name a few. So for the focus groups, we're going to go into the strengths, opportunities, existing resources, and health needs. Again, there were 17 focus group discussions that were completed within Pitt County between May and July of last year, with a total of 182 participants. Participants included the list that you see in front of you, community health workers, health providers, community organization professionals, community members of various ages. You can see that we had a senior group and we also had high school students for the community groups. This table shows the types of the focus groups that we did. Focus group transcripts were coded and analyzed by common themes, and the frequency with which a topic area was discussed in the context of needs and concerns or barriers and challenges to achieving health was used to assess the relative importance of the need in the community. Key themes that emerged from the focus group discussions are integrated into the report by topic area with an emphasis on the most significant needs as evidenced by both primary and secondary data. This table shows the focus group results for Pitt County by topic area. The focus group transcript texts were analyzed by the Conduent team using a list of codes that closely mirror the health and quality of life topics used in the data scoring and community survey process. Topics with higher frequency and mentioned in the context of needs and concerns or barriers and challenges suggest greater need in the community. Most importantly for us to know for this chart are the topics with a frequency of more than 50 are included in the overall list of significant health needs. So you can see the two here that reset criteria are access to health services and exercise, nutrition, and weight. So data synthesis, bringing it all together. All the forms of data have strengths and limitations, and in order to gain a comprehensive understanding of the significant health needs for Pitt County, findings from the secondary data, community survey, and focus groups were compared and analyzed for areas of overlap. The top needs from each data source were identified using the criteria used in this chart. So for the secondary, it was the topics receiving the highest data score. For the survey, it was based on issues most affecting the quality of life in Pitt County. And for the focus groups, it was those with the highest frequency, as we saw in the previous slide. Bringing all that together, this is a Venn diagram. It represents the results of all the data collected from secondary sources and primary sources, which were the community survey and the focus groups. So for the secondary, the very top circle, you can see what came out through the secondary data, a lot of what Amy is going to be telling you. Maternal, fetal, and infant health, immunizations and infectious diseases, occupational and environmental health, chronic diseases, and economy. Now from the primary data, you have two circles on the bottom. On the left, it was the community survey, and what came out of that was the economy and the social environment. And on the right, again, primary data, which was the focus groups, exercise, nutrition, and weight, and access to health services. And you can see from the diagram that the only overlapping issue was for the secondary data and the community survey was the economy.
May I ask a question real quick?
Yes.
The focus groups identified access to health services, but the other ones did not. So
Correct.
it's interesting. I guess it's sort of like anything else. It depends on who you ask.
Right. Right.
We're blessed to have the hospital, medical center, and the health department, all the excellent services available, but there's still issues with access in terms of financial.
Right.
I'm sure. So.
All right, the 9 topic areas that you saw in the Venn diagram were identified across the 3 data sources. The 5 topic areas with the highest secondary data scores are explored in depth and include corresponding data from community participants when available. And I don't know if you can you go to the next one? Thank you. I don't know if you can tell in this slide, but the ones that are bolded are the first 5 that we're going to talk about, and they were from the secondary data sets. The economy, immunizations and infectious diseases, maternal, fetal, and infant health, occupational and environmental health, and other chronic diseases. Following these 5 topic areas are what's termed other significant health needs, and they will include discussions around additional topics identified specifically in the community survey and in the focus groups. So we're going to start with the first 5. All right, here we go. For maternal, fetal, and infant health, key issues identified by Health ENC around this topic included low birth weights, preterm rates being higher in Pitt County than in the state, and this topic not meeting the Healthy People 2020 goals for infant mortality rates. From the community survey, the 4th highest ranking service needing improvement in the community was positive teen activities. And the 7th highest ranking health behavior that people in the community needed more information about was preventing pregnancy and sexually transmitted diseases.
Okay, so sharing some of the secondary data that supports what Stephanie was just sharing with you for the infant mortality rates in Pitt County, comparing Pitt County to North Carolina, also the United States, Healthy People 2020 and Healthy NC 2020. In Pitt County, the rate from 12 to 16, and this is per 1,000 live births, was 11.4. North Carolina was 7.2. You see we're much higher than North Carolina. We're also much higher than in the United States at 6 per 1,000 live births. And the Healthy People 2020 goal was 6 per 1,000 live births, and Healthy NC 2020 was 6.3. So Pitt County is much higher than any of those other benchmarks. I actually showed you the same slide back a few months ago when we were reporting about the State of the County Health Report and where we are with infant mortality as it compares between white or Caucasian babies and African American babies. And as you can see the trend beginning in 2009 all the way to 2016, you can see how much higher the rate is of infant death among African American babies than among Caucasian babies. So we've got a lot of work to do to continue to narrow that disparity. This is showing you the percent of babies with very low birth weight. In Pitt County, 2.4%. North Carolina, 1.7%. United States, 1.4%. And Healthy People 2020, 1.4%. There again, Pitt County is higher. Very low birth weight. Pitt County, 9.6%. North Carolina, 9%. United States, 8.1%, and healthy people, 2020, 7.8%. So we're continuing to be higher there. Sorry, I didn't advance that slide. I did want to share with you, though, remind you of PIMPAC, the Pitt Infant Mortality Prevention Advisory Council. This group has continued to direct numerous infant mortality reduction strategies in our community. It is the oldest active infant mortality prevention advisory council in North Carolina. It's about 30 years old. Jennifer Hardy, who presented to you earlier about the child fatality prevention team, leads the work of that group. And there are many, many initiatives that have continued to address infant mortality in our community. And we have seen some changes in a positive way, but there again, we still have a lot of work to do.
All right, our next topic area is immunizations and infectious disease. Gonorrhea, syphilis, and chlamydia incidents are higher, their rates are higher, TB rates are higher, and HIV diagnosis rates don't meet the Healthy NC 2020 goals. From the focus groups, 5% felt that preventing pregnancy and STDs were issues that the community needed more information about. Shifting gears, 75% reported that they had received a flu shot, so that was good. But in general, this topic was not brought up extensively in the focus group.
So providing you some of the secondary data to support that. As far as syphilis incident rate for Pitt County, 13.6 per 100,000 population as compared to North Carolina at 10.8 per 100,000 and the United States at 8.7. So there again, Pitt County is much higher. Same holds true for gonorrhea incidence rate. Pitt County is 374.7 per 100,000 as compared to North Carolina at 194.4 and the United States at 145.8. Again, much higher. Chlamydia. Currently, Pitt County is the #1 county in North Carolina, and not in a good way, meaning we had the worst chlamydia rate in North Carolina. In 2016, the chlamydia incidence rate in Pitt County was 1,074.4 per 100,000 population, as compared to North Carolina at 572.4 and the United States at 497.3. Not where we want to be.
Amy, could I ask a question?
Sure.
When you compare these rates, Pitt County from last year, are we closing the gap, or is the gap just as big as it's always been?
It's just as big as it's always been. There was a time a couple of years ago where we did see a drop, but we're not moving in the right direction with that.
Let me just ask a question about the, because of Violet Medical Center being here, we get referrals in from approximately 30, 31 counties. Whenever these cases are diagnosed, are they allotted to the county from which they reside, or are they allotted to Pitt County because they're diagnosed here?
They should be in the county that they reside.
Reside, okay. So that way, if, and I know we've discussed this before, if a student's here, for example, from some other county, then their case would actually be allotted back to their county, not to Pitt. So
if they're living on campus, but if they are living off campus and they've established an off-campus address as their permanent residency, then they would be counted as a Pitt County resident.
Okay.
However, if you compare, even though we're a college town, if you compare our rates to other college towns, our rates are still higher.
So that leads to the question, are you going to give us any breakdown as to age, demographics of any type for these rates, or have you done that?
We have not done that, but we can work with Conduit to do that for us. And there is a website that Conduit is part of this payment that the 33 counties have given them, and they've established a website that has a lot more data than we're able to provide for you tonight, that we can get that through the website. Okay, this next one was HIV diagnosis rate, which was Pitt County 23 per 100,000, North Carolina 16.1, and Healthy NC 2020 22.100,000. And then the last one was the 2016 AIDS diagnosis rate. Pitt County was 10.1 per 100,000, and North Carolina 7.0 per 100,000. I did also want to take this opportunity to remind you of the new STD educator that we had hired back, not even been a year yet, Shayla Hayes. That was a new position that the county commissioners allowed us to have a couple of years ago. Shayla started in this past May, and she is already implementing 2 programs that are evidence-based CDC programs. One is sister to sister that she's working with our clinic staff right now to do one-on-one counseling and condom education with our patients that come in very often presenting with an STD. And this would be for female patients. She's also doing a group called Voices, which is the video opportunities for innovative condom education and safer sex. Their group sessions she does in the community with high-risk groups, they're again the proper use of condoms. And both of those programs have been shown to make a difference in the STD rate. So we're hoping that by implementing those programs in time, we will see a difference.
All right. Issues around occupational and environmental health include asthma increasing in the Medicare population, and hospitalization due to asthma is higher in Pitt County. From the community survey, occupational and environmental health was 12th highest ranking issue affecting quality of life in the community. However, there was no discussion around this topic in the focus group, so that came from the community survey only.
Okay, and this next one is data scoring results for occupational and environmental health. The first category on the left you see is, this is asthma among Medicare population in 2015, and it's expressed in the form of percentage. So 8.5% of that population for Pitt County, 8.4% in North Carolina, and 8.2% in the United States. Having asthma, and that source is the Centers for Medicare and Medicaid Services. We also base this information as far as environmental health on the physical environment. Our county health ranking showing that when it comes to physical environment, Pitt County ranked number 60 out of all 100 counties, number 1 being the best county and number 100 being the worst county. You do have to keep in mind with the ranking of our counties that we could stay the same within any given year and another county improve or get worse, and it will change our ranking. So you do have to look at that when you're looking at the ranking. And the last indicator on here is age-adjusted hospitalization rate due to asthma in 2014, and this is per 10,000 population. In Pitt County, it was 123.7 per 10,000, as compared to North Carolina at 90.9, and there was no indicator for the U.S. Also want to further point out that according to our Pitt County Health Department Environmental Health Division records, ensures that water quality and safety through our inspections and our permits, and there were no significant reports of events relating to water quality since the last community health needs assessment. And actually during the last needs assessment there were no records of any kind of significant events related to water quality within Pitt County. So we can thank our environmental health staff for that and keeping a close monitoring on our water quality.
The next area is chronic diseases. For chronic kidney disease, it is higher in the county than in North Carolina or the U.S. in the Medicare population, and the trend is increasing. Now, from the surveys, caring for family members with special needs and disabilities was a healthy behavior that the community needs more information on. And from the focus groups, chronic diseases were viewed as a top concern.
The next slide represents data that we received from Vidant Medical Center. This is showing you a breakdown of the top diagnosis for emergency department visits. acute respiratory infections, chest pain, headache, viral infections, urinary tract infections, chest pain, low back pain, acute pharyngitis, nausea with vomiting, and acute vaginitis. Those were the top reasons given to us by Vidant. The next slide are the top diagnoses for emergency department visits that resulted in actual hospitalization or in admissions. So the first would be sepsis or blood infections, hypertensive heart, chronic kidney disease with heart failure, acute kidney failure, hypertensive heart disease with heart failure, COPD, a heart attack, major depressive disorder, pneumonia, urinary tract infections, and stroke. Those were the top ones that resulted in admissions from people presenting to the emergency department. The next slide you've also seen before during the State of the County Health Report presentation, so I will review that with you. These are the leading causes of death through 2016. Cancer, which was the leading cause of death in 2014 and 15, actually surpassed heart disease, was surpassed by heart disease in 2016. Heart disease rose from 149 per 100,000 population in 2015 to 165.3 per 100,000 population in 2016. During this same period, cancer dropped from 164.4 to 136. Although stroke remained as the third leading cause of death in 2016, the rate dropped from 48.3 in 2015 to 39.5 in 2016. And again, this is all per 100,000 population. Chronic lower respiratory disease moved from the 5th ranked leading cause of death in 2015 to the 6th leading cause of death in 16. And then Alzheimer's disease climbed from the 6th leading cause of death in 15 at 27.3 to the 5th leading cause of death in 16 at 33.3. Diabetes remained as the 7th leading cause of death, but the rate per 100,000 population dropped. Even though it remained at that same ranking, it did drop from 26.7 to 24.3 in 2016. The rate of septicemia also dropped from 21.6 in 15 to 12.2 in 2016. During the same period, motor vehicle injuries dropped from 16.5 per 100,000 population to 12.4. And in 2016, the rate of kidney diseases and disorders was 10.7 per 100,000 population and climbed back into the top leading causes of death. So when compared to North Carolina, Pitt County had lower death rates in 2016 for all of the leading causes of death, although there was a rise in Pitt County's death rates for both heart disease and Alzheimer's disease between 15 to 16.
Amy, it seems like we'd be higher than North Carolina in something. I mean, how can we be lower in everything? Where are the numbers? Where do we make up the numbers? Because if this is per 100,000 population, I mean, do we just have fewer people dying?
Good possibility, yeah. Not really sure. Right.
So
But
some of these we were higher, like kidney, we have a higher rate of kidney disease, correct? But we have a lower rate of death from it. I'm remembering a lot of data.
Right.
Is that true? Which
Right.
that implies that we don't do a good job of stopping you from getting it, but once you get it, we take good care.
Prevention from dying, right. Yeah.
Amy, I think one thing that needs to be mentioned is the correlation between many of these chronic diseases.
Yes.
I mean, you might die from kidney disease, but good chance you got heart disease at the same time.
That's very true.
So, just kind of prevention of that as a whole instead of picking one out to
Right.
attack.
And of course, the behaviors that are correlated with all of these diseases that have come out within our, such as exercise, tobacco use, other substance use, physical inactivity. Those are some things that came out in the focus groups and the opinion surveys that are related to all of these leading causes of death, or the majority of them anyway.
Is Alzheimer's specifically Alzheimer's, or is it any dementia? Or is there different types of dementia?
Right, and I would need somebody medical to answer that.
Okay.
Yes.
Okay, yeah, that's fine.
Okay. This next slide you've also seen before, but I like to continue to use it because I think it does a good job of telling you which way we're going since we've been looking at the ranking of these diseases from 2013. And what I'd like for you to look at, if you can see, the top three from 13 to 16 have always going to be cancer, heart disease, and stroke. Stroke has remained top three for as long as I can remember in the third place. Cancer and heart disease will flip-flop. But if you look at number 4, at the chronic lower respiratory diseases, I want you to notice from 13, 14, and 15 that it stayed in the 4th ranking for all 3 years. But in 16, it dropped to the 6th ranking. That may have something to do with the smoke-free restaurants and bars law, where fewer people were being exposed to secondhand smoke. That is one theory that we have with that. Also, if you look at number 5 at diabetes, it's highlighted in yellow. It was number 5 in 2013, but in 14, 15, and 16, it was number 7. Hopefully that can be attributed to the numerous diabetes prevention programs and management programs that we have in place. Mr. Spade, as you were saying earlier about, doing a good job of keeping you well, diabetes self-management. We have 2 programs. One can help prevent it, and the other can help manage it once you are identified or diagnosed as having it. Number 6 is all other unintentional injuries in 2013, highlighted in the pink. As you notice, rather than that going down, that has continued to climb. In 14 and 15, it was number 5, and in 2016, it was number 4. Opioid use and abuse is in that category. So more than likely, that is why that has climbed. And then number 7 is the last one that I wanted to point out to you as far as Alzheimer's. That was ranked number 7 in 2013, and it has continued to climb in 14, 15, and 16. It climbed to number 5. Some say that maybe that's better diagnosis. Not really sure about the climb in that, but it's worth looking into to see why.
All right, the next topic area is the economy, and these things were higher in Pitt County than in the state and the U.S. The percentage of children and family living below the poverty level, housing problems, children living below the poverty level, and students eligible for free lunch. As far as the community survey goes, poverty and economy were top issues that negatively impacted the quality of life, and from the focus groups, financial stress was a top concern in discussions. People talked about affordable healthy foods, recreational activities, and seeking medical care due to cost, that they don't.
This next slide is about our tier designation. The North Carolina Department of Commerce annually ranks the state's 100 counties based on economic well-being and assigns each a tier designation. So the 40 most distressed counties are designated as Tier 1, the next 40 is Tier 2, and then the 20 least distressed are designated as Tier 3 counties. And Pitt County in 2018 was assigned or designated as a Tier 2.
Do we have an absolute number on that ranking, or? I know overall I don't recall.
How close are we to Tier 1?
Yeah, we would have to look to see that data. I mean, we can
Okay.
get that information to see how close we are.
Yeah.
So just giving you an idea about the median household, which it reflects the affluence or prosperity of an area. Areas with higher median households incomes are likely to have a greater share of educated residents and lower unemployment rates. This particular graph does show that the median household income for Pitt County is $42,308, as compared, it's much lower than North Carolina's at $48,256. And the median household income for Pitt County is similar to other eastern North Carolina counties, but still lower than North Carolina's. Looking at the poverty level, 24.5% of the population in Pitt County lives below the poverty level, which is higher than the rate for North Carolina at 16.8% and eastern North Carolina region at 19.2%. So the federal poverty thresholds were set every year by the Census Bureau and vary by size of family and ages of family members. So a high poverty rate is both a cause and a consequence of poor economic conditions. Children in poverty are more likely to have physical health problems, behavior problems, and emotional problems. Seniors who live in poverty are an especially vulnerable group due to increased physical limitations, medical needs, and social isolation. So there's another area that we look at. Children living in poverty, the rate of children living in poverty below the poverty level is also higher in Pitt County at 28.2% when compared to North Carolina at 23.9% and Health ENC counties at 27.6%. For people 65 and over, the rate of older adults living below the poverty level is higher in Pitt County, 11.1%, higher than North Carolina at 9.7%, but slightly lower than the eastern North Carolina region at 11.5%. Not much lower, just a little bit. This is a socio-needs index. This was produced by Conduit, the paid vendor that we were sharing with you earlier. Conduit Healthy Communities Institute developed this index to easily compare multiple socioeconomic factors across geographies. This index incorporates estimates for 6 different social and economic determinants of health, which is income, poverty, unemployment, occupation, educational attainment, linguistic barriers that are associated with poor health outcomes, including preventable hospitalizations and premature death. So as you can see here, the zip codes with the highest rank are the ones with the most need. And so Bethel, Greenville, and Stokes all rank at 5. Greenville, the 27834 zip code, which is West Greenville area, that we have several projects that we have implemented in West Greenville as part of the Health Department and Pitt Partners for Health and East Carolina University to address those issues. And the community is very involved in that area too. And then followed by Ayden, Grifton, and Farmville at a rank of 4, and then Fountain at 3, the Grimesland at 2, and then the 27858 Greenville zip code ranking at 2, and then Winterville at a number 1. So Winterville would be the showing or presenting the least amount of socioeconomic need.
All right. The next 4 topic areas termed Other Significant Health Needs includes discussion of the additional topics, again, that were identified specifically in the community survey and the focus group discussions. They include access to health services, exercise, nutrition, weight, social environment, and substance abuse. So starting with access, though over 74% of respondents had health insurance through an employer, the insurance did not always cover the needed services. Another area of concern was difficulty accessing healthcare services from a dentist or general practitioner. In the focus groups, the concerns that were discussed included barriers such as accepting health insurance plans, scheduling appointments, and lack of transportation to medical centers. Farm workers were specifically referenced as a group needing more access to services due to hours and distance. Need for additional full-service community health centers and rural locations were discussed, and other discussion was around getting free clinics for low-income and uninsured individuals, increasing the options for telemedicine or clinics that are open outside of regular work hours.
May I ask a question? Can we get a breakdown on the challenges there with accepting health plans? Not tonight, but
Yeah.
Saturday or something?
Yes.
Oh,
Okay.
All right, for exercise, nutrition, and weight. Now, this topic was discussed at length in all of the focus groups. Concern for obesity across all ages, especially the youth, access to affordable, healthy foods, and not knowing how to eat healthy. From the focus groups, more information that came was cultural norms around eating in the community, not learning to cook healthy foods or enjoying the healthy foods as much as they do the unhealthy foods. And from the surveys, there was a high frequency response to learning more about managing weight and exercise or nutrition. A quote from one of the focus groups participants: "The area we live in is poor. People don't have money or food, will eat anything, and the cheaper foods are unhealthy, especially rural areas. Even free food is not healthy sometimes. If you are hungry, you will eat whatever is available." The next topic is social environment. And around the social environment, improvements are needed in the community around positive teen activities, counseling, mental health, support groups, improvements around parks and rec, and help for people during times of need. Discussion in the focus groups were around the impact of adverse childhood events, talking about abuse, neglect, and how it impacts the community over time, and more support being needed for families. And a lot of people brought up maybe having programming in churches, which we currently do, but it was brought up specifically around that topic. A focus group participant speaking on the social environment said abusive relationships, child abuse, and domestic violence, people with mental health, lack of information on how much child abuse impacts communities when dealing with mental illness. Yes, also trauma history. People come in with trauma and don't know. And this is the last one, substance abuse. The top issue affecting quality of life, desire to learn more about prevention, wanting to know where to go for people who were trying to quit smoking. And on a positive note, and this is for the surveys, 98% reported no illegal drug use. From the focus groups, substance abuse came up 27 times as an issue, as there is easy access for substances and alcohol, but not for those seeking help.
Can I ask, does that include the increase in teens who are now vaping and then going on, also being exposed to nicotine?
I think from the focus groups, when they talked about the smoking, it was specifically smoking, like cigarettes,
Okay.
not the vaping. All right, I brought the Venn diagram back because that's a lot of information so that we've talked about all of it now and you can see it once again. The secondary data being on the top and the primary data from the surveys and the focus groups.
So based on the information that has been shared, we've shared this with Vidant Medical Center Board of Trustees, Pitt Partners for Health. We did actually had a much lengthier presentation with Pitt Partners due to the time that we had, shared a little bit more data. And based on the data that was presented, these are the 3 areas or the health priority areas that Vidant Medical Center, including Pitt Partners for Health, identified to work on the next 3 years. The first one was chronic disease, and that's pretty broad. But the leading causes of morbidity, including risk factors such as high blood pressure, poor nutrition, and inadequate physical activity. The next was access to care, social determinants of health, including insurance, affordability, transportation, and availability to including primary care, specialty care, and dental care for children and adults. And then the last one was mental health, to reduce the rate of mental health-related visits to the emergency room and suicide prevention. And in blue, those came from the Healthy North Carolina 2020 objectives, and we may not, or Pitt Partners may not be able to focus on every one of those areas. So now that they've chosen the priority areas, they'll come back and meet and break it down as to what they really can concentrate on for the next 3 years. So that brings us to the priority area selection for the Board of Health, for public health to work on in addition to Pitt Partners for Health in the hospital. And we'll save that for the board retreat for this Saturday. We'll provide you with some additional information. And that retreat again is Saturday the 16th from 9 to 1. We will ask you to think about, when ranking the priorities, to think about these 3 areas One is, what is the magnitude of the problem? And we'll have this for you on Saturday as well. And the magnitude of the problem, meaning how many people were actually affected by the problem. The seriousness of the problem, meaning the degree of disability or premature death that occurs due to the problem. And what are the potential economic and social burdens to the community? And then the last one is the feasibility of a successful intervention. Can we really do anything about it? Is the intervention feasible scientifically and acceptable to the community? What resources are necessary? Is the problem preventable? So those will be the things we need to think about before we move forward with priority selection. So the final timeline would be to complete the priority selection, which will be done on Saturday. Then we'll have to complete the full report. We do have some additional data to add, and we're still cross-checking some of the data that was provided to us. Then we'll submit that report to the state for review in late March, early April. And then after that, we will develop our action plans. For the health department, they're called action plans. For the hospital, it's called an implementation plan. But we'll work together on doing that, and then we'll begin the activities to meet the new goals that will be established as part of all of these plans. And that will be between April to September, and the work will begin as far as implementation. So for more information, for anybody in the community that would like to work with us on any of this, my contact information is here through the health department, or Stephanie Cabanis through Vidant Medical Center, Pitt Partners for Health. Anybody can get involved in Pitt Partners for Health and come and help us, you know, launch this work and help improve the health of the community.
Thank you all very much for a very detailed presentation. Do the board members have any additional questions? We'll look forward to discussing this more on Saturday. So thank you all. It's a lot of work. Appreciate it. Okay, our next item here for discussion, now that Tammy's back, is the Health Director's report.
Okay, I do have a few things to update you on. One is our new dentist. We're very excited that we have a new dentist, and I'm going to ask Marcia Hall if she will come to the podium and introduce our new dentist and say a few words.
So I've been here 15 months, and we have been without a dentist, and I am so glad to introduce our new Smile Safari Dental Unit dentist, Dr. Kimberly Vinson. She started the end of December, and she has hit the ground running, and I'm going to let her have a brief moment to introduce herself, but we're going to bring her back in a few months so she can share some deliverables with you and let you know how the school year wrapped up.
Good evening. Dr. Kimberly Vinson, trained here at East Carolina through and through. Went to ECU undergrad, class of 2016, ECU School of Dental Medicine. So happy to be here. Right now, we are at Aiden Elementary School. We just finished Wintergreen, and hopefully we'll get to see a couple more schools before exams, and then we kind of have to stop and run our summer clinic hours. Hopefully, I'll help with some of our Healthy 2020 goals, as like reducing childhood carries. And right now, I'm working with the Oral Health Alliance and Sealants, and working with some other local agencies to help minimize childhood carries. And we're doing Kids Fest this year, so that's the highlight of my evening, trying to get together cool stuff for kids to come see me. So I'm just glad to be here.
We're very happy to have you aboard.
Yeah, welcome.
Thank you.
Does anybody have any questions before you?
Before I run away.
See if anybody has any questions. Maybe we'll have some next time. then.
Yeah,
So,
and I'll have a
thank you
whole
very much.
presentation for you.
Fantastic.
So
Thank
much.
you.
And I did want to share, and correct me if I'm wrong, but the mobile dental unit will be at the health department this summer?
That's the plan, to have it running through the summer. Starting the second week, hopefully sometime in June, up until when school starts. Traditionally, it was at the Boys and Girls Club, but we hadn't gotten a lot of interest from the community, but I believe that if it is at public health, people will see it, considering that women's, infants, and children are cared for public health, and during the summertime, everybody brings their kids in. So it'll be, oh, the Smile Safari is here. They'll come and we'll get more of a boost and people will come see us.
Do they make appointments through the health department?
They do make it directly through the health department, and then they're fed through it. It would be appointment only. Currently, it wouldn't be walk-in, but we'll see how things change.
Good.
Do you have any help? Is it,
I have a great admin who has been with the Smile Safari for 14 years, and lucky me, I just got a assistant hired on, and the three of us are the team that's making it work. Dreams of grandeur, I'd have 2 assistants, but you know what? We'll see how the budget goes and how I produce and things like that. But my goal is to have dentistry be a true unit in public health, so an entity, a large entity that we can make a large impact as far as access to care in this community, because it seems like that's the biggest hurdle that I have, that people can't find Medicaid providers or health care choice providers. And I just want people to know that we are here. And yeah.
Very
Good
good.
luck.
Very good. Thank you.
Good to have you.
That's all right.
Just a few other things that I did want to share about our WIC operating during potential federal government shutdown. We don't anticipate a shutdown right now unless something that's happened on the news that I haven't heard. But even so, if we were to have a federal government shutdown, we have been guaranteed that we have funding for the WIC program through the end of March. Also, want to announce that environmental health staff did receive an Association of Food and Drug Officials grant, a $3,000 grant, and that's to further support supplies for inspections, training, complaint investigations, operational cost. So we were really excited to get those funds. And then the final thing I wanted to mention, that 2 of our programs have been invited to reapply for grant funds to the Violet Health Foundation to support service delivery. One of those is the Nurse Family Partnership Program, which is a home visitation program for first-time moms. It is an evidence-based intervention to help improve birth outcomes and infant mortality. And then the final one is the DSME, or better known as the Diabetes Self-Management Education Program. That is another evidence-based program designed to help people successfully manage their diabetes.
All right, very good. Any questions for Amy? All right, is there any other new business? Okay, with that, we're going to need to go into a brief closed session. So as we go into closed session, we'll certainly go ahead and dismiss the guests tonight. Thank you all very much for coming. Those of you that are students, if you're finishing up in the spring, you heard there were 6 nursing positions open at the, here with the health department. So certainly encourage you to take a look at your own employment opportunities and include us. So thank you all for coming. Okay, thank you. We're back on the air now. Is there a motion to come out of closed session?
So moved.
Is there a second?
Second.
All in favor, say aye. Aye. All right, any opposed? All right, we're back in open session. Is there any additional business for tonight?
No.
All right, hearing none, is there a motion for adjournment?
So move.
Is there a second? All in favor, say aye.
Aye.
Thank you very much. Motions, the Board of Health meeting is adjourned for this evening. Thank you.
Thank you.